Hello, Reverend Dr. Tracey Allshafer here, and I am sitting with Jennifer Redmond, Dr. Jennifer Redmond from Samsara Chiropractic Wellness Center in Somerville, New Jersey. And we're here to talk about NET today. But first I want to talk a little bit about you. So give us a little bit of background. You're a holistic chiropractor.
Yes.
But how did you come to be a chiropractor? Where did you train? And then how did that lead you to this NET before we get into that?
That's a great question. So I was I just started college and I was trying to figure out what I wanted to do with my life. I knew I wanted to help people somehow, but I wasn't quite sure what that was going to look like just yet. And my mother got a pinched nerve in her neck, and she started to lose the feeling in her hands. She couldn't turn her head. And she was a preschool teacher, so it was pretty important for her to be able to, cut small things and color things, and she put a lot of things together for her classroom. So that was pretty important to her, and she ended up seeing a chiropractor, and within a month, she could turn her head, the feeling was back in her hands, the pain was gone, and I watched what he was doing, and I was just kind of amazed that he was doing this just with his hands, because I had grown up in a household with a father who worked for a pharmaceutical company. So he was really big into prevention, but once something went wrong, the only solution I knew of was drugs or surgery. So it blew my mind watching the body heal itself just from the intervention of hands. Yeah. So, it was my second trimester, and I called my parents, and I'm like, I don't know what to do. I can't sleep. And then I had classes from 8 a.m. until 6 p.m. every day of the week. It was an intense schedule with like neuroanatomy, cadaveric anatomy. It was an intense, very rigorous program.
Yeah.
And I said, I don't know if I can do this. I was an honors student in undergrad, but I was like, I don't know if I can hack it because I can't sleep at night. And then I didn't have the focus for my classes during the day. And they said, go to the counselor, go to the school counselor. I'm sure they've dealt with this before. And so I went to the school counselor, and it turned out that the school counselor was Mark Foes, who is the first therapist to ever get certified in Neuro Emotional Technique. And he said, wow, it sounds like you're going through a lot. Do you want to try something different? And I said, I will try anything. And he had me put my arm out, and he started this whole muscle testing thing, which I was brand new to. And within a few minutes, I felt like the weight of the world had been lifted off my shoulders. I went home that night. I slept 12 hours straight, and I came back the next week for more. And I decided that I wanted to somehow incorporate this into my practice. So
It's always amazing to me how the simplest things, if you just connect the circuits somehow, whether it's with frequency or energetically, how simple something can shift.
absolutely.
Everything.
Yeah. I feel like you never know when the next breakthrough is coming because it is the simplest little things. Yeah.
So this NET, you do traditional chiropractic?
I do traditional chiropractic.
Okay.
The principle behind Neuro Emotional Technique, at least Scott Walker, the developer of the technique, came up with something called the home run formula. And what that is first base is structure, because NET is a chiropractic technique. Okay. And it's based on the principle that the structure is going to be addressed, whether that be through chiropractic adjustments or through acupuncture or some other kind of technique that allows the body's own healing ability to perform at its best possible level. And so with the structure, and well, maybe I should digress a little bit, because the principle behind chiropractic is really that the nervous system is controlling everything, and that if the nervous system is controlling everything unimpeded by any interference, that it actually has the capacity to heal anything, because anything that comes up in the body, which is a self-regulating self-healing organism. If it's not healing, something's getting in the way.
Right.
So the home run formula looks at the different things that could be getting in the way, and one of those things being the structure. So that's where the chiropractic adjustment comes in to address the structural component. There could also be some sort of nutritional deficiency. There could be some sort of toxicity. We live in a very toxic world. Right. And then finally, there could be some sort of emotional stress that is interfering with the body's ability to heal.
Yeah.
Yeah. So.
Well, I know just from years of teaching yoga what stress can do on the body. And, sometimes we spend, 15, 20 minutes, the first 15 or 20 minutes of a yoga class just getting people's nervous system to relax.
Exactly,
right?
Exactly.
Just to kind of slow down. And so I was reading a little bit about the NET and these, whether it's a trauma or an event that creates this stress, I guess, cycle.
Yeah.
And a lot of the time, we're completely, we don't even know, right? It's just happening. We have a response or a similar response. It triggers that same reaction, and it's creating this pattern.
Yeah, repetition compulsion, as
That's
Freud
what we
put
call
it.
Yeah. Yeah. Today, at least, I think that the medical community is definitely getting behind how important it is to understand the stress component. And I mean, in the last, I had a yoga studio for 22 years, and it was probably the last 10 where people were starting to call and say, my doctor recommended this, right?
Awesome.
So I love that the medical community is starting to get behind some of these practices and these techniques. And I know that, maybe can we talk a little bit how the medical community sometimes has an issue with chiropractic care.
Oh, boy.
And they don't really get behind that. I
Yeah.
mean, you just said you went to pre-med.
Yeah.
It's an extensive certificate, or it's not certification, it's an actual
licensure. Yeah. And actually, there are more course hours in nutrition, in anatomy, and there are more course hours and all of that than there are actually in medical school. There was actually a lawsuit against chiropractors. Chiropractors were going to jail because they were getting accused of practicing medicine without a license. And there was, the history on this, they actually created an entire movie called Doctored because there's just so much information about this.
Really?
But the AMA formed a committee against quackery, which was really directed at chiropractors, and they were trying to stop chiropractors from practicing.
What year was that?
Oh, what was that? I think it was in the 50s or 60s, perhaps. But they brought a lawsuit against the chiropractors, claiming that they were practicing medicine without a license. But eventually, I believe it was 1992, when the Supreme Court threw out the appeal and said, you cannot appeal this again. Chiropractors are practicing chiropractic. They're not practicing medicine. And they have a right to practice chiropractic.
Wonderful. Bravo.
And that is when we start seeing something shift in the medical profession.
I think what I always appreciate about chiropractors is what we've kind of been talking about. They, in my opinion, understand the body more holistically.
I mean, it's the difference between mechanistic functioning and vitalistic. So mechanistic would be looking at one piece, like, oh, this one little gear here, versus vitalistic is saying, how does this gear work with the whole picture? So I think you're spot on with that.
So you said before that this NET, it's made for chiropractors. What about acupuncturists? Is it like a blend? Or?
So it was originally a chiropractic technique, and it still is. However, it has broadened its scope to welcome in other practitioners because they saw how it could be so useful for acupuncturists, because it does use a lot of elements from acupuncture. Not that we use needles, but we use the same points. But also, there are psychiatrists who do NET. There are psychologists who do NET. As I mentioned, my introduction to NET was through the first psychologist ever certified in NET. And the only reason he was certified is because he was working at a chiropractic college. So they thought, oh, well, he has connection to chiropractic students. He can show them the technique. But it opened the door for the other therapists, which it's so helpful with resolving phobias, anxiety, depression. So I feel like it's a wonderful tool in any therapist's or psychiatrist's tool bag. Certainly better than, it's a better first choice than medication for sure. Yeah.
So can we talk a little bit about what exactly it is?
Sure. Yeah. Honestly, I feel like it's better demonstrated than described, but it takes elements from psychology, like repetition compulsion, and elements from acupuncture, the meridian points, which meridians are just energy channels, and also a little bit of visualization. There's also muscle testing that's involved, but it combines all of these things into a very elegant system that takes just a couple minutes to get to the root cause of the stress that's stored in someone's body.
Okay.
And to clear that stress or neutralize that stress.
Does the NET itself clear the stress, or does your
Well, technically your body clears the stress, but the Neuro Emotional Technique gives your body the proper tool to just, it basically connects a circuit that had short-circuited before, reconnects the circuit, and then allows you to integrate the three parts of the brain. There's the brainstem, which is that just basic survival, breathing, heart rate, things like that. There's the emotional part of the brain, or the amygdala, and then there's the cerebral cortex, which is that rational thought. And so using NET, we can integrate all three of those brains so that the stress can actually process itself through instead of getting stuck in a repetitive loop.
So I have not talked about muscle testing yet on the show. And I mean, I know there's different types of muscle testing. I've taught people how to do self-muscle testing. It's very difficult to get people to do it. Usually their brain is overriding the technique. So I do feel like, when I go to a nutritionist or somebody that does the muscle testing for me, it's much more accurate. But explain to the viewers a little bit how muscle testing works, because it does seem to be a really big part of NET.
Yeah, it is. And what's really interesting about muscle testing is that one of the most well-known instructors of NET that I will not mention, he did not believe in muscle testing when he first got introduced. He was an MD, and he said, I don't know, this might be hogwash, and I cannot participate in something that is hogwash. So he actually researched it. And he's an amazing researcher, and he researched using a control of the names Frank and Ethel. He had people get muscle tested on saying their name. And they would say either their name is, you'd say, my name is Tracey, or they'd say, my name is Ethel, depending on their, gender that they identify with. And so they found that it was 100% accurate as far as people's own thoughts about themselves. Now, if there was one exception, if somebody did not resonate with their birth name, say they went by a different name, they generally would not muscle test accurately on their name being their birth name. They would test accurately on the name that they identified with.
Right, yeah.
So muscle testing is used many, many different ways, but in NET, it's used to test what someone is congruent with versus what they're incongruent with, versus, like, for instance, your name, you are congruent with your name being Tracey. You are not congruent with your name being Ethel, because it's not what you identify with. So using that, and the muscle testing itself is simply a reflex. So just like we have that reflex that makes our leg kick when we tap our little patellar tendon, the muscle test is just checking the strength of a muscle, introducing a concept, and seeing if the strength of the muscle is maintained. If the strength of the muscle is not maintained, I like to say that the brain is kind of distracted by the incongruency of that thought not matching, not being in alignment with one's unconscious reality or conscious reality. And so we can use the muscle testing to tap into the unconscious reality. So whether you think you're okay healing or whether you just want to be okay healing, we can actually use the muscle test to determine whether it's which direction of the coin we're falling on.
Okay. Yeah.
Yeah.
You put it beautifully in a medical term and terminology. Usually when I'm teaching people from, we're from an energy perspective. So I'm talking about like it's oneness and we're part of that oneness. So if something is true, we know it within us. It's innately true, right? And that's how the muscle testing works. But
yeah. And I think you could describe it either way.
Yeah.
But I really love demystifying it for all the skeptics, because some people, and you know what, I am a skeptic. I'll admit that openly. I am such a skeptic about so many things, which is why it's so important for me to help to serve those people in our communities who are skeptics too, and showing them that there is research to support this thing, that it is not just floofy woo-woo. It really, and I agree with you that we are all one, and that probably is why it works so well. But I love that we have research to back it all up.
So for whether you need that medical backup or not, all of these things that we're talking about on the show and that are coming about in such a bigger way today, we can validate either way.
Yes,
I love
100%.
it.
Yeah.
I really love it.
Yeah.
So let's do a quick muscle test.
Sure.
Just to show, because again, people need to see what it's really
Yeah.
about.
Yeah.
So how do you?
So I'm going to take this arm here.
Okay. Yeah, this is my good arm. That's a good idea.
Good. Perfect. What's going on with that arm? Just curious.
Oh, that's a long story. But I had I tore lots of tendons in the shoulder in January.
Oh, wow.
And then I had a frozen shoulder. So it is still healing.
Wow. Okay. Do you have any range of motion issues?
Oh, yeah.
Okay.
I have a lot of issues.
Do you want to work on that?
Yes, I would love to.
Let's do that. So I'm just going to show the muscle test first. So I'm not trying to overpower you. I'm just trying to make sure you can hold your arm up against my pressure. So I'm just going to have you hold your arm up against my pressure. Hold. Good. And I'm going to check. There's a polarity point right here. Good. Perfect. And you're holding that up nice and strong, and I'm touching that polarity point. So that's just showing that the reflex is active. But for the sake of the camera, I'm going to have you say, my name is Tracey, and I'm going to have you hold that muscle strong.
My name is Tracey.
Good. And I'm going to have you say, my name is Ethel.
My name is Ethel.
Now, just make sure we didn't break your muscle here. I want you to say, my name is Tracey again.
My name is Tracey.
Yeah, perfect. So let's see the range of motion you have on that left shoulder.
Yeah. Yesterday it was fabulous, but this is my issue with this. I never know what I'm getting any day when I wake up. And so today it's very sore.
Okay.
And it won't move.
Okay. So I'm going to have you just bring it as high up as it'll go. Okay. And we're going to check your emotional points. We're going to check these guys right here. And we're going to check those. So we need a couple of things. Your body is showing that there is a stress component that's interfering with that range of motion. Okay, so generally speaking, there are only two things that stress everybody. It's either love and all our relationships, or money and all the material stuff. So let's check the concept of love and all those relationships. Okay, and we'll just check money just in case. Nope, it's going into the relationship category. So we have generally two different types of relationships. We have friends and family, right? So let's check friends. And let's check family. Okay, so in the family category, we have male and female, generally speaking. So let's check male family, female family. Okay, and in the female category, who's the first person that comes to mind in your female family members?
My mom.
Concept of mom. It's usually mom. So
to spend a month with mom.
It's usually that'll do it.
And I tore the rotator cuff with mom.
There you go. Okay, so concept of we're gonna.
I love you, mom.
Of course you do. And mom didn't do anything wrong here. But let's see what we have. So we're gonna check some different meridian access point and see which one gets strong when you're thinking about mom. Okay, so mom, 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 Mom. All right, so we're on your heart meridian. So there's the heart meridian, the heart meridian has a bunch of emotions associated with it, mainly lost and vulnerable. So let's check concept of lost, concept of vulnerable. Okay, and the concept, it could be your vulnerability or somebody else's. So let's check yours, someone else's, yours. Okay, so you drop that down. So let's just double check the concept of your vulnerability when you think about Mom. Okay, so you can drop that arm down. So and what ended up happening? Like, how did you hurt your shoulder with her?
Her lower back went out. It was actually her sacroiliac joint. And she couldn't move or walk and do almost anything. So I was helping her, you know, the couch cushions were getting smushed, and I said, let me move them. I'll switch them out. So I reached with this arm and I tugged on it twice. And when I tugged the second time, I felt a searing pain in here. And I doubled down.
Yeah. What was the most vulnerable thing about that moment for you?
Well, I was trying to help her.
And
then I couldn't help her. Yeah.
And what was the worst part about that for you?
I think I am, my whole thing is helping people. So
what happens in the moment that your whole thing is taken away?
I guess invalidated and, you know, feeling,
Yeah.
vulnerable.
Okay.
Yeah.
So, the finger right there. Can you get your head down to your hand? Is that more comfortable than bringing you're going to be putting your forehead.
Oh.
Yeah.
Yeah.
But I'm just thinking it might be better for your shoulder if you lean on your hand, on your palm, instead of bringing your arm up. And you can lean forward too if it's more comfortable. So I'm going to tap some points on your back gently. And what I want you to do is I want you to let time collapse, and I want you to be a little 6-year-old you, feeling so vulnerable because you felt like there was no place in the world for you in that moment. Just making room for all the vulnerability and any other emotions that little 6-year-old you was feeling. Breathe in. Blow it out. And breathe in. And blow it out. Okay. And when you're ready, you can take your hands off and sit up. So what we were doing is having you visualize your 6-year-old experience, and that was a perfect example of one of those things that Freud would have said got caught in a cycle of repeat, right? So at 6, you experienced this moment that was just so painful that you felt like you couldn't be you anymore. You had to retreat into this other world. And with your mother, you couldn't be you anymore. And the vulnerability attached to that. And so what we did is we had you connect the emotional points. You know, when people get really stressed, they're like, oh, I've had such a long day. They're just intuitively hitting those points. We connected your heart meridian at the same time. Heart meridian. And then we tapped the corresponding vertebral points on the back. Because there are certain vertebrae associated with different meridians. And then we had you kind of relive that experience. Now, the interesting thing about the brain, too, is that it can't tell between something real and imagined. Having you imagine that scenario, we can time travel in a way and bring you back to that setting and allow those circuits to be supported by supporting the meridians while you're experiencing it. If you could be a 6-year-old and attaching those points in that moment, it probably wouldn't have gotten stuck, but you didn't know that back then. So we're actually doing that now and allowing your body to actually find resolution for that emotional storm that didn't have a resolution before. And the breathing engages that cerebellum, that reptilian brain, And the feeling, the emotion of vulnerability engages the amygdala, and then the story of what happened is the cerebral cortex. So we're taking all three of those brains, integrating it with the breath, doing all the corrections while we're in that space, so that we corrected your 6-year-old self and allowed that emotion to fully process. Check in with that shoulder one more time.
The pain's gone.
I suspect that there's probably a few more other things going on in there. There's like some adhesions. There might be some more emotions stored in there.
Yeah.
We could work on it for a while if we really...
We probably could be here a very long time. Yeah.
Yeah, but I'm glad that we got the pain reduced. That's good.
One of the things that I can see with the NET is that you might have to continue to work through this process.
Yeah, if it's something really big. You know, some patients, they'll have this, you know, big cathartic release and it's just done. But then there's others that it's like this is a complicated injury where things have gotten torn and things like that, right? So it might take a little bit longer. And the other thing is, no one's really ever done. Like, you know what I mean? Growing, developing as a human being.
Right.
So I feel like you don't have to get NET forever and ever and ever, but I can't imagine not getting it ever again because there's always new things that come up. You know what I mean?
Right.
Yeah. But with NET, once something is cleared, it's cleared. Like, it's not, you don't have to repeat it. You don't have to do it over and over again. There may be different NECs or neuro-emotional components involved in one issue, but you won't have the same thing. And if it seems like the same thing is coming up, it's usually because you're not getting to the root of what's underneath it.
Yeah.
Yeah.
I was thinking that because what we just did obviously was some stuff, but there were very particular other situations at different times in my life. So I'm sure that, like, this is not the first injury of this shoulder. We didn't even talk about that.
Yeah,
right?
yeah. And if you were a patient, I would probably, on your treatment plan, one of the things that I would love to do is say, have you say the statement, I'm okay feeling good consistently, I'm okay healing consistently, because there's this lack of consistency in your shoulder's improvement. You know, it keeps it keeps getting better, and then it gets worse. And every day. Yeah, and even things like I'm okay healing, which is a big one I use around here, because if someone comes in and they've had a long-standing chronic issue, there usually is like some unconscious belief about healing that's getting in the way.
Yeah. But you're saying that your experience over the past 17 years of bringing this particular technique into your practice has shown you, I mean, like, beyond a doubt how significant that this is for people's healing.
Yes. I mean, I have seen such profound shifts so quickly. I mean, my own personal experience with NET, just between, like, you know, I got one thing cleared, I went home and I slept 12 hours when I hadn't been able to sleep, but it continued. And then I've had the experience with patients too, where they'll walk in not being able to turn their head. We clear one thing with NET and all of a sudden they're like, oh my gosh, it's working just fine now, you know?
Yeah. So let's talk about how people can learn more about this particular thing and how they can go about finding a provider in their area if they're interested.
Well, the website for Neuro Emotional Technique is www.netmindbody.com. They have a link where you can find a practitioner near you. There is also a beautiful documentary that was eventually we released it on YouTube. It was originally on Amazon. It was released on Gaia TV, Food Matters TV. But eventually we just said, you know what? We want to make it available for everybody. It's about an hour long. It's called Stressed, Stressed.
So thank you.
Thank you.
That's always a good day for me when something something helps.
Yeah, when
with
something
the
helps.
Feeling, right?
Yeah.
And
thank you so much.
Thank you. Thank you.